medical physician, clinical researcher, and medical legal consultant to talk about Code of Medical Ethics.
So, hello everyone. Welcome back after the tea session. Meanwhile, before the presentation starts, just a brief introduction. I'm a clinical physician, currently getting my training in clinical pharmacology and therapeutics, and additionally, I'm certified from NLSIU Bangalore, which is one of the prestigious colleges for legal training. So, I'm also trained in legal aspects of both medical as well as ethical part. And I know most of you are from the healthcare background, and with the NMC, the National Medical Commission, and a lot of changes been happening in the healthcare setup. A lot of focus has been now in India, especially for the ethics part. That's why also this particular session. So to start with, a brief disclaimer. This is a very introductory and awareness-based orientation program. Small session I will be taking, and I will just state that all the views I will be sharing are personal, and I'm not entertaining any kind of my past. And in the interest of time and this conference, I'll be taking my presentation to the digital theme only because ethical concerns are very widespread, ranging from clinical trials to surrogacy to euthanasia and a lot of things. Yeah. So a lot of times there is a lot of confusion happening. What is exactly moral? What is ethical? And what is exactly medical ethics? So there is a very thin line of difference between each and every term. So if we talk about only ethics, so it is the moral reasoning of actions and refers to a professional moral conduct. So a lot of time you will be seeing that a lot of ethical code of conduct are different for different professionals. Whereas for moral understanding, it depends continuously to the individual to individual. And whereas if I talk about medical ethics, it is implemented only in the case of practice of medicine. So that's why we call it simply medical ethics. And just like I mentioned, a lot of confusion regarding moral and ethics. So simply remember, moral is a simply difference between evil and good, and ethical is simply when you are guided by your professional guidelines. So primarily there are four pillars of medical ethics. If I talk about one, that is the pillar of beneficence. Second, the pillar of non-maleficence, and third is the pillar of autonomy and pillar of justice. So these are very well understood terms. Some important things I wanted to discuss, primarily not entertaining only for the physicians. I'm practicing physician, so I wanted to mention it. But a lot of you are from other backgrounds linked to various parts of healthcare. So you can well adapt to these things. The first pointer is that always remember that the ethical imperative for the physician is the welfare of the patient. You must don't do any harm. Doesn't matter whether you can do any good or not, but you don't harm any patient. Second is that you should always approach the patient with consideration and always respect their personal dignity, the right to intimacy and privacy. The privacy I will be covering later on. And the third is that a lot of physicians perform a lot of diagnostic and therapeutic interventions as well as preventive procedures, and they should be exhausted and devoting the necessary time, because in India we all know that the ratio of patient care towards the doctor-patient ratio is very poor. So that time crunch is an issue. But if you practice ethical medicine, which is very evidence-based, then you need to understand that due intelligent time needs to be given for that. Fourth point is that all the physicians and the healthcare workers should maintain the confidentiality. It doesn't matter whether you have obtained the right frame of consent or not, whether the patient is alive or dead, but you must try to maintain the confidentiality both in the court of law and also in the clinical practice on daily basis. Fifth and the last is that it is the duty of every physician to continually update and develop professional knowledge by working and by getting training in various CMEs, working and entertaining a lot of post-skilled workers and interacting with fellow colleagues as well. So now I will be talking more about the digital component because our theme is today is the digital health. So a lot of time people ask me exactly what is the artificial intelligence, and a lot of students, budding medicos also a lot of time mention on the LinkedIn profile that we are data scientists, we are this and that. But it's always to remember that by far the greatest danger of AI is that people conclude too early that they understand it. And a lot of panels in yesterday and today's also have mentioned that we need to be a friend of AI rather than fearing of it. But simultaneously, we need to understand that it is a continuously evolving process. Due diligent appreciation should be made regarding this. Yeah, there are a few concerns I wanted to discuss linked to AI. The first is the inequality. We need to understand that primarily this field of technology are primarily driven by the big tech companies, and they are working primarily to make unmeant money. So if you talk about healthcare industry, most of the workers, be it the physician, be it the nurses, all are paid based on hourly wages. For example, if I talk about any contract or any workforce, not exactly in the government sector, everybody is hourly driven wages. So if you talk about any tech company, health tech startup, everyone is working to minimize this and to improve the productivity of an organization. So this brings us to conclusion that a lot of healthcare workforce might be at a negative or disadvantage compared to these tech companies. So we need to understand that where this inequality goes, and this is one of the ethical concerns while taking decisions in near future. Next comes the AI bias. So we need to understand that nobody is completely unbiased, be it any model or be it any human being. So our all the trained algorithms, the data that based on which they are being trained on, they are to some extent not exactly unbiased, and simultaneously the person who is involved in training that data set is also having that bias into picture. I would just like to share one example. A medical insurance company, when does any kind of AI algorithm training, a lot of time you will see that a lot of bias has been towards the black people, because it has been seen that the black people have got some kind of financial disadvantage to their names, and in the past they have not paid their premium at the right time, and also they have a lot of disease history. So these kind of biases do happen. Third is that security concerns. So as we're building up models, a lot of time there will be a lot of data breaching happening, and that's why cybersecurity and a lot of things that our esteemed panel has discussed today comes into picture. Fourth is that the evil AI. So this is a quite new concept to most of you. So for example, nowadays we are building up models, building up robots, which are quite capable of doing so much big stuffs that our human mind can't. So for example, we build an algorithm and ask that can we prevent or can we completely eliminate cancer from this planet? So imagine a model answering that, just remove all the human beings. So that is the level of evil AI we can think of in the future. Last point is not that much ethical if you think from a direct perspective, but yeah, energy consumption is also a big challenge if you think from a wider perspective and wider lens. Now we are leading as India in the G20 summit, and one of the key challenges is handling the greenhouse gas effect. So we need to understand that all these AI models are being trained on the basis of large data set. So they are taking a lot of energy into that. So we need to understand that while selecting any model, we are taking into consideration the energy consumption. Next comes the privacy aspect. So a lot of health apps we are using, and a lot of data they are using. So I just wanted to quote one of the statements made by our Chief Justice of India. He mentioned that privacy recognizes the autonomy of the individual and the right of every person to make essential choices which affect the course of life. In doing so, privacy recognizes that living a life of dignity is essential for a human being to fulfill the liberties and freedoms which are the cornerstone of the Constitution. So, while making any apps or using any apps, we need to understand this and keep this point in mind. These are some of the recent incidences, both at AIIMS and ICM are happening. So this talks about a lot of data breach and need of cybersecurity. And the last statement mentions that we are now reaching a milestone. This is a figure from a couple of weeks back. So now it must have increased. So we need to understand that security is a big concern, both from a patient privacy point of view, and also we need to include the cybersecurity aspect. We can't stop telemedicine from booming. No doubt before the COVID pandemic, it was quite not legal in India to practice, but now after the pandemic and in 2020, we have the guidelines coming up. I know that they are not perfect, but yeah, to a great extent, they are covering a lot of aspects. I will just covering 7 elements. First is the context. So we need to understand that telemedicine can't be implemented everywhere. You can't implement telemedicine for a trauma patient or an ICU patient. So you need to understand that what context you're implementing. Then comes the aspect which mode of communication you will be implementing, whether it will be audio platform, whether it will be a text based or a call based or a video platform. Second is the identification of RMP and patient. With the coming of NDHM, there will be proper registry maintaining, so that will help to prevent quackery happening. Fourth is the consent. I want to mention about there is something called informed consent and something called blanket consent that needs to be taken into consideration while practicing telemedicine. Patient evaluation, we need to understand that all the kind of diagnosis can't be made through telemedicine. So that's also one limitation, and we need to understand that. And last comes the patient management. Not only prescribing the right medications, we need to focus also on patient education and counseling. So this is one of my book. I got it published last year. I have covered a lot of things related to ethics here, primarily linked to the pandemic and a lot of other aspects to COVID. And a lot of discussion happened today and yesterday also that how to, you can say, balance our business sense and with ethics. So I just want to sum it up that success is the progressive realization of how many people are better off because you live. So just like Dr. Vibha mentioned today, so just learn and understand that whatever decisions you're taking, it will affect billions of lives directly or indirectly. And to conclude, this is one of the robots that was made in 2019, Humanoid Sophia, and the creator does not fear AI. So rather he wanted to become its friend. So I just want through this, you can say, dice to mention to all the medicos and to all the healthcare workers, there is a lot of fear towards AI that we lose our jobs. But believe me, we doctors, we healthcare workers are pluripotent in nature. We are just like stem cells. So we can modulate ourselves. We are believing in the Jugaad technology, and we work in a very remote and resource-limited setups. So if you focus on the right people and the right training, we also can imbibe the skills, and we can be better. I have no doubt in saying that 5 years or 10 years down the line, you will find at least thousands of Indian doctors working in the field of computation and making good progress, and they might be leading unicorn startups also. So with this, I want to conclude. These are my social media handles. If there is any query, you can connect me. And thank you very much for your time and patience.
Thank you so much, sir, for presenting undeniable facts. Now I would request Dr. Brajendra Singh Dillon, Senior Professor, Head Department, Hospital Administration, PGIMS Rohtak, to felicitate Dr. Hara Prasad Mishra. Thank you so much, sir. Dr. Hara Prasad Mishra, medical physician, clinical researcher, and medico-legal consultant.